Bad breath, also known as halitosis, is an unpleasant odor emanating from the mouth. It is a very common condition, affecting almost 50% of the world's population. Usually, it is not caused by disease. The first and most common cause of bad breath is poor oral hygiene. Food particles in the mouth rot and cause a bad odor due to bacterial buildup, which produces foul-smelling gases. Almost 60% of bad breath cases are caused by poor dental hygiene. Now, the question arises, what is the most scientifically evidenced method to minimize mouth odor? The best practice is considered to be brushing your teeth twice a day, once in the morning and once at night before sleeping. Each brushing session should last at least 2 minutes, using a soft-bristled toothbrush and fluoride toothpaste. Flossing once a day also improves breath, as it removes food particles and plaque from between your teeth. Using an antibacterial mouthwash is another effective component of oral hygiene. Periodontal disease is the second most common cause of bad breath, responsible for almost 20% of cases. It involves the infection of gums and supporting bone, eventually leading to tooth loss. Periodontal disease is caused by the buildup of plaque and bacteria around the teeth and gums. Scaling and root planing are considered the most effective ways to treat gum disease. Scaling removes tartar and bacteria from the teeth, and root planing, or deep cleaning, smooths the root surfaces and removes tartar and bacterial endotoxin. These procedures reduce pocket depths and importantly improve the condition. Scaling and root planing are recommended every 3 to 6 months, depending on personal needs. Among antibacterial mouthwashes, chlorhexidine is considered the gold standard for short-term usage due to its beneficial effects against a wide spectrum of bacteria. The typical dosage is 2 tablespoons, rinsed for 30 seconds, twice a day. Do not dilute it with water, and avoid eating or drinking for about 30 minutes after rinsing. It is recommended for use around 2 weeks, but not for long-term use. Another common cause of bad breath is dry mouth, responsible for approximately 15 to 20% of cases. Dry mouth, also known as xerostomia, is often caused by breathing through the mouth and leads to easy bacterial growth. This is because saliva helps cleanse the mouth by physically washing away bacteria and neutralizing the acids produced by bacteria. When the mouth is dry, it encourages bacterial growth and bad breath. Drinking water is the simplest but most effective way to improve oral hydration. Avoiding alcohol and caffeine is also advised, as both contribute to dehydration. Chewing sugar-free gum helps stimulate saliva flow. Products containing xylitol are particularly beneficial because xylitol helps reduce harmful oral bacteria. Additionally, try to breathe through your nose as much as possible, rather than through your mouth, since mouth breathing causes both bad breath and dryness. Tobacco use also leads to bad breath. Several foods, such as onions, garlic, and spices, can cause bad breath too. Gastroesophageal reflux disease, GERD, and postnasal drip can also lead to bad breath, though these cases are rarer compared to the aforementioned causes. The main characteristic of GERD is heartburn, which worsens at night and after eating. The primary symptom of postnasal drip is the feeling of mucus in the throat and a constant need to clear the throat. Due to the sensation of mucus trickling down,